Good afternoon. The number of COVID-19 cases across the country continues to increase, nearly 1,500 and over 20 deaths. Prince Edward Island has 3 confirmed cases. These numbers really reflect the seriousness of the situation, and it is why we really need to continue to talk about the importance of 1, self-isolation for those who are need to do so, and 2, social distancing, and 3, we continue to prepare our system for an increase in cases. I think as part of that preparedness and as we continue to want to look for cases in this province, our testing criteria has evolved and will continue to change. We initially, weeks ago, were testing people who were returning from Wuhan and Hubei province in China, and over the weeks, in sync with the national guidance, tested returning travelers from Iran, Italy, and other international countries if people had symptoms. And over the last number of days and going forward, we are wanting to make it clear to the public and also to our providers, clear communication will go out to them later today, that we are wanting to test those travelers who have returned from outside the country and outside the province who are having symptoms within the last 14 days. And this is part of our search and our desire to make sure we have early identification of cases and look for any evidence of any community transmission. And I think that'll be important in the days ahead. So certainly anyone who does have symptoms and a travel history, please call 811 if you're having cough, fever, difficulty breathing. And we are hoping to increase our testing numbers in the days ahead so that we can look for cases of COVID-19 here in PEI and continue to do so. As of this morning, there have been 400 tests conducted in PEI, and we, as I mentioned, we'd like to see increased number of tests done here. I know we've talked about social distancing and self-isolation, and they're terms that are new, really, for all of us. And they're so important, and they are what may make a difference in these next couple of weeks. And so I'm going to take a little time today to make sure that we understand what they are and maybe understand some of the differences between them. So first, social distancing. It's what we all should be doing. Everyone should be staying home as much as possible. But of course, there's still reasons that people need to get out, going out for fresh air, going out for groceries, picking up prescriptions. And when we are leaving our houses, we must practice social distancing, staying at least 6 feet away from others. And this applies to everyone who is not self-isolating. And that applies to teenagers, adults. And we are hearing certainly teenagers who may not be taking social distancing guidelines seriously. And I'd like to just highlight to parents to be very direct about why this is so important and try as much as possible to be aware. And I know it's teenagers, but what your teens are, where they are and what they're doing. It's also good to talk about what is not social distancing. So going over to a friend's house for coffee is not social distancing. Going to the store with your entire family is not social distancing. Only one member should be designated to go to the grocery store. While you may not feel sick, and while we know these measures are an inconvenience, we have to remember that other members of our community who are very vulnerable to COVID-19 and will get more seriously ill if they get COVID-19. And I'll use this as an example. My mother lives down the street from where I live, but we did not have her come to her grandson's birthday the other night because we wanted to try to protect her, and that was part of social distancing. And it was hard for her, and it was hard for my son. It was hard for all of us, but that is what social distancing is right now. That is what we are going to try to do to protect our community. So in terms of self-isolation, I want to thank so many Islanders who are self-isolating on return from travel or if they are cases of COVID-19. It is not easy. And again, these measures are being taken not only in PEI, but across the country in order to flatten that curve, slow the increase in cases in the weeks ahead. And I have been asked to try to be as clear as possible because although most people who are supposed to self-isolate are doing a really good job, there are some who are not. And it does not apply to some people and not for others. I know there are exemptions in terms of self-isolation, and we have listed those and we talk about those. But for anyone who is not exempt, self-isolation is for 14 days associated with any travel outside the province. And that is Canada, outside of Canada or outside of PEI. We are hearing people who are supposed to be self-isolating who are stopping at the grocery store or gas station on their way home, for instance, from the airport or wanting to run out to the grocery store. That is not part of self-isolation. Who needs to be self-isolating on PEI? I think I've talked about it, but I'm going to mention it again. Individuals who recently returned from out of the province within the last 14 days, individuals who are a close contact of a positive case of COVID-19, and individuals who are waiting or have had testing completed and are waiting that period of 14 days. And what can you do when you're self-isolating? You can accept food and groceries on your doorstep. You can go outside if you stay on your own property or close to home, being respectful to maintain social distancing when you're outside. So you need to engage with your neighbors and friends to drop off essentials. And there are community groups who have been so supportive to individuals with these needs as well. It means self-isolating does not mean going to a drive-through. It does not mean doing your banking and not going to homes of other people who are self-isolating. And these are just challenging concepts. They're challenging to do, but we're even getting that message federally and right across our provinces and territories. Earlier today, the message being "Go home, stay home," and some of that applies to those who are social distancing, but it particularly applies to those who are self-isolating. We've also had a number of questions about people in apartments, and I've been asked to address that. Again, it is if you are self-isolating in an apartment, it's still okay to get out for some fresh air, but you need to be clear that you are maintaining social distance as you try to get between you and any neighbors. So you should not be stopping at the laundry room or any other apartments to visit. You should go directly outside if you can from, for instance, a patio if you're on the ground floor, then go back into your apartment. And we need to work together to do this right. There are all sorts of situations that are coming up we're trying to address and trying to figure out. So I woke up this morning, and I think a lot of us do, and say, when will this be over? And I want this to be over for our families and our community and our businesses. And the question is, we don't know for sure. But what we do know is what we do right now will make a difference in the next couple of weeks. And it will influence the outcome. These measures are important to try to understand, to follow, so that we protect ourselves, our loved ones, and our community as a whole. Thank you. Aujourd'hui, je vais tout de suite suivre en français. À l'île du Prince-Édouard, il y a 3 cas confirmés maintenant et beaucoup de cas au Canada, presque 1500. Et ces nombres sont importants et c'est pourquoi c'est nécessaire de s'auto-isoler. Maintenant, les tests sont pour les personnes qui ont voyagé à l'extérieur de la province, qui ont des symptômes. Et l'auto-isolement est pour tout le monde qui a voyagé à l'extérieur de notre province. On change les personnes qu'on teste et en raison des taux de Covid-19 et en raison de la propagation communautaire. Alors, on veut savoir s'il y en a des autres personnes partout à l'île qui a de Covid-19. À ce moment, il y a 400 tests qui sont réalisés depuis ce matin et j'espère de voir ce nombre beaucoup plus de tests cette semaine. Ce n'est pas facile, mais ce sont des mesures que nous pouvons prendre pour aplatir la courbe pour les semaines et les mois à venir. Je veux être claire. Tout le monde doit s'isoler pendant 14 jours après tout voyage à l'extérieur de l'île, sauf qu'il y a des exceptions, mais pour tous les autres, ils doivent s'isoler. Vous pouvez prendre de l'air, mais vous devez pratiquer la distance sociale. Pour ceux qui reviennent de voyage, vous ne pouvez pas aller à l'épicerie, par exemple. Pour rester chez vous autant que possible. Et lorsque vous êtes dehors, la distance sociale est essentielle. Respectez les 2 mètres. Aux parents, parlez-en à vos ados de l'importance de la distance sociale et essayez de garder un œil d'où ils sont et ce qu'ils font. Et je sais que c'est assez difficile avec les ados. On doit travailler ensemble pour réussir. Et je ne sais pas si j'ai mentionné en anglais, mais je devrais en faire que les parcs et les terrains de jeu, c'est pas là où on devrait aller parce que c'est difficile de garder la distance sociale et aussi c'est pas quelque chose qu'on peut nettoyer facilement. On me pose la question souvent, quand est-ce que ça va être terminé? Et je ne suis pas certaine. Mais je sais que c'est nos actions aujourd'hui qui sont tellement importantes et auront un impact direct sur les semaines et les mois à venir. Merci.
Good afternoon. On behalf of Health PEI, I just want to thank our staff and physicians who are making tremendous strides in planning and responding to the COVID-19 pandemic. I want to thank everyone for their cooperation so far. We're working together as a system in our response, and our coordination and teamwork will be a key factor in our success. We continue to offer essential services across the province, and this helps ensure we have the capacity and staffing resources needed to respond to the pandemic, which also ensures Islanders receive safe, high-quality care when they need it. We have had an excellent response from our call-out to retired physicians, nurses, healthcare workers, service workers, and volunteers. Over the weekend, we had more than 76 calls from Islanders who want to help. And we're in the process of reviewing and gathering these people as licensed and registered professionals so they can be ready to work in appropriate settings. It's inspiring to see so many Islanders willing to take part and keep our province safe and healthy. The Joint Response Team has been carefully monitoring our personal protective equipment needed for our healthcare workers to ensure they can provide care safely. Maintaining the health of our staff and physicians and our patients is our guiding priority in this response. In providing equipment to staff and physicians, Health PEI follows the direction set by the Chief Public Health Office and the Public Health Agency of Canada. This is aligned with guidance from the World Health Organization and has been endorsed by Canada's Special Advisory Committee on COVID-19. By providing the right equipment and to the right care workers for the patient populations they see, we can help ensure everyone's safety while also maintaining our supply of protective equipment. The key to exposure control for healthcare workers is also to have plans in place that limit the spread and limit the number of staff who are exposed to the virus. So some of the measures that we have planned and put in place include screening for respiratory symptoms at the entrance to emergency departments and specific assessment and treatment areas for patients with suspected COVID-19 illnesses. I want to just offer our thanks as well to Dr. Morrison and her staff for their continued work in the surveillance and monitoring of the cases on PEI and working with us at Health PEI to help guide our staff in the planning and preparations we've been doing. Thank you.
I have to open it for some questions.
Wayne Thibodeau here from CBC. Dr. Morrison, I know you talked a bit about wanting to increase the number of tests. Obviously, we still are seeing quite the lag on those test results coming back from Winnipeg. How much closer are we to starting testing here in PEI?
Well, I had that discussion yesterday, certainly with the lab. It's getting closer. So I think if all goes well, and I'm sure my medical microbiologist is going to be nervously awaiting what I'm going to say here, but it could, we had said a couple weeks last week, and I think that's still possible. So another week or two, we should have that available here. We also spoke with the National Microbiology Lab and had a conversation with them on the weekend, and I think we are certainly reinforced the fact that we are relying so heavily on the National Microbiology Lab and the important work they do, recognizing that they are also incredibly busy. And I think I anticipate some more regular results coming in and turning over. So it's... And they are aware that we are going to be expanding our testing and sending increased tests in this week, and so they are sort of bracing for that as well.
You had mentioned about the frustrations of getting some people, teens, I think you mentioned in particular, to understand the gravity of all of this. In Nova Scotia and some other provinces, we're starting to see police agencies now being involved, and that if people have concerns, call the police. How far are we down the road on doing that here in Prince Edward Island?
So the conversations are occurring, some this morning and later this afternoon, with government and police services to discuss the provisions that are in the Public Health Act and in the order of what that could mean and what that looks like, and logistics around that. And so I think you, Wayne, will be speaking more about that at 5 o'clock today, and so there'll be more details at that time.
And if I could just get a quick update on the three current COVID-19 patients. I think you said yesterday 2 of them had, or I guess all 3 had mild symptoms. Can we just get a bit of an update on the condition of the 3 individuals, please?
So the first case has finished her self-isolation time and was doing well, and then the other two cases are doing well at home, and they are being followed every day by public health nursing and health PEI, as well as the contacts.
Thank you.
Stu Neatby here from The Guardian. Just wonder if, Dr. Morrison, you can tell me a little bit more about what the procedure is for, it's been over about 2 weeks since the first individual returned to PEI. So once this person has finished their self-isolation time, what's the protocol?
So if they are a healthcare worker, they would not go back to work until they had 2 negative tests 24 hours apart. And following the national guidance for mild illness, if you're not in hospital and you're at home and you have mild illness and you feel well, then they are let out of self-isolation and can continue to practice social distancing after that 14-day period. Now, that's different if you're in hospital, obviously, or if you have getting any complications or getting worse, then it would the process, of course, would be different. And as I mentioned, for healthcare workers.
Okay. And so you had talked a little bit about expanding the testing for individuals who are coming from out of province. So in the last week, it looks like we've more than doubled the number of tests from Monday to today. So I guess in a week's time, what does that look like in terms of just like the mass number of testing that you'd like to see done on the island? Would we see another doubling or more so?
Hard to know for sure. I mean, I think we want to make sure that those who are having symptoms, who may be returning from British Columbia or from the United States or overseas, if they have symptoms, then they we'd like to make sure they're tested for that early identification and containment really of the illness, and it will give us a better sense, certainly, if we don't see any evidence of the sustained community transmission that they have in certain provinces in the country, but we want to make sure, and so the testing, the expanded testing is, I think, important for us to do that. So I'm not sure how many numbers that will mean, but we have testing clinics that are available 8 hours a day, 7 days a week, and we will continue to use those for mild illness, and of course those who are sick and being admitted to hospital with influenza-like illness, or for instance, who have severe acute respiratory illness, it's called SARI, those patients would be tested regardless of any travel history.
Okay, and last question for Ms. Dowling. I guess before the end of the week last week, there was a press release from a number of unions, including the PEI Nurses Union, that suggested that all healthcare professionals should be fitted with N95 respirator masks. So just wondering within the current protocols whether that is happening.
Yes, we do have the N95 respirator masks, and as I mentioned earlier, we follow the guidelines from the Public Health Agency of Canada, which complies with what the World Health Organization is advising for those specific treatments or procedures where that's indicated, and we have those supplies available to staff who are doing those things. We're working on some clear communication for staff to go out today, just so they are aware of what that guidance is, and we can be really clear with them on that.
Thank you very much.
Hi, Dr. Morrison, Sean McDougall from the Eastern Graphic. I just had a few questions. First one maybe for yourself or for Ms. Dowling. Last year, the province had put out a request for new ventilators for the Queen Elizabeth Hospital and the Prince County Hospital. It stated that part of the current fleet was nearing the end of its life cycle. And I'm just wondering, has the province found a company to fill that request? And as a follow-up, are they able to maintain the current fleet of ventilators?
I can answer that question. So we have been working through that request for proposals process with a particular vendor, and that is where we're looking to purchase some additional ventilators from outside the request through the national committees where we've also sought some additional ventilators for the purposes of the pandemic. And with respect to the ventilators we currently have in service, we are expecting to and have been able to maintain those and have them regularly serviced and kept up to date. So they are currently all available and ready for use should they need to be. And we do plan for the immediate future anyway in keeping those machines maintained and available for use if they're needed, even after purchasing some of the additional ones.
Okay, and I just had another question to you, Ms. Dowling, just about healthcare workers. Over the weekend, Ontario announced that there was 13 healthcare workers that tested positive for the COVID-19 virus, and I'm just wondering what the number of health professionals in PEI that have been tested.
I actually don't have that information as far as the specific individuals who've been tested. I know that we have been working with Dr. Morrison's office on making sure that if we do have healthcare workers, and especially going forward, if we have any healthcare workers who are experiencing symptoms like fever or cough, they will be tested and screened. But I don't actually have any information on healthcare workers who have been tested at this time.
I think it's a good question. We certainly know there are healthcare workers who have been tested, and they are indicated through our lab as a priority. And so one of the sort of expanded criteria for testing will be a fever or new cough in a healthcare worker. This week also we'll be looking to do testing on them as well. And again, some of the details around that we'll be sending out to our healthcare providers this afternoon.
Okay, and I just had one final question for yourself, Dr. Morrison. With the new screening measures at the point of entry for the province, is there numbers available on the amount of people that have been screened at the airport?
So, I think we thank you for the question, because I think it's a good chance to clarify because we've had some follow-up. So the borders are not closed to our province, and I think we need to be clear. We're not preventing people from coming home or coming to visit or coming into the province for some exemptions for work. Some people need to come home and see a relative who is in palliative care. So the borders are not closed. However, we are wanting to make sure that everyone coming onto the island is getting very clear information in their hand and understand that they need to self-isolate. And I think people want to do the right thing. They don't want to harm others, and they don't want to be the cause of a spread of COVID in PI. So it's important, certainly, that they get that information. So we are asking initially for symptoms, and if they don't have symptoms, we are making sure that they have the information. So in terms of numbers being screened, it would be the number of people who have come off the airplane and the number of cars and the number of trucks that have come onto PI. So we have not calculated those, or I've not heard those numbers, but I'm sure that my public health official or environmental health officer who was standing in the cold last night on the bridge, they might be able to have that number for me, but that is not something that I've been asking them to collect.
Thank you.
Question en français pour vous, Dr. Morrison. Je vous ai posé la question hier concernant les contrôles au point d'entrée de la province, notamment au pont. J'ai cru comprendre que rien n'avait changé depuis hier. C'est toujours une simple discussion, remise d'un papier d'information. Est-ce que vous avez avancé sur ce dossier? Est-ce que vous allez mettre plus de moyens en place, par exemple récolter les numéros de téléphone, les adresses, prendre peut-être la température des personnes qui pourraient rentrer dans la province? Et est-ce que vous avez travaillé sur un moyen de contrôler que ces personnes-là vont s'auto-isoler chez eux après leur entrée à l'île du Prince-Édouard?
OK, merci pour la question. En premier, on a les pouvoirs dans la législation du Public Health Act qu'on peut, et puis dans l'ordre, qu'on peut chercher le nom, le numéro de téléphone, les détails d'où vous venez. Mais on a fait pour hier et pour aujourd'hui, une décision de pas écrire à point chaque détail de chaque personne. Et c'est pour quelques raisons, et puis ça va peut-être changer. Premier, que je pense que la plupart des gens, s'ils comprennent qu'est-ce que auto-isoler veut dire, s'auto-isoler veut dire, ils vont le faire. Deuxièmement, si je mis les officiaux qui travaillent pour nous au pont de prendre l'identification de tout le monde, ils vont ils vont être plus proches de 6 pieds, 2 mètres. Alors, ils vont aussi être en risque. Ils vont, tous les deux, le public et les personnes qui travaillent pour nous, parce qu'ils vont pas respecter le social distance et la distance sociale. Et ils vont prendre le nom de n'importe qui a une fièvre, qui tousse dans la voiture. Et ils nous donnent ces numéros et on les appelle pour faire tester. Vraiment, vous parlez de qu'est-ce qu'ils ont fait en Taïwan, je pense peut-être Taïwan et à d'autres parties au monde où ils vraiment track tous les gens qui entrent. Et on n'est pas là. Mais plus tard cet après-midi, on va parler des pouvoirs qu'on peut faire et les résultats ou les impacts si vous ne suivez pas auto-isoler. Et ça va peut-être être un peu plus clair cet après-midi parce que c'est pas seulement les personnes qui reviennent sur le pont, mais il y a des personnes qui arrivent de l'aéroport aussi. Mais c'est important que on suit cet ordre pour protéger tout le monde. Alors, c'est important en premier d'être certain que tout le monde comprend qu'est-ce qu'on fait et aussi de protéger la public et les personnes qui travaillent sur le front line.
Follow-up sur cette question. J'ai parlé du pont. Maintenant, je voudrais parler des résidents de l'île de la Madeleine. Ces personnes-là rentrent pour la plupart du Québec, prennent le pont de la Confédération, traversent l'île, dorment parfois à l'île du Prince-Édouard avant de prendre le bateau. Est-ce que vous avez discuté avec des personnes des îles de la Madeleine? Est-ce que vous allez prendre des dispositions pour, par exemple, interdire aux Madelinots de dormir à l'île du Prince-Édouard, de rester dans leur véhicule une fois qu'ils passent le pont pour se rendre au bateau? Même chose dans le sens inverse, est-ce que vous allez les obliger à, une fois qu'ils arrivent à Souris, de rouler directement en dehors de la province? Est-ce que vous avez discuté déjà de tout ça?
On a dit deux parties de la question et je vais peut-être répondre et je m'excuse, je vais essayer de aussi répondre à tes questions en anglais après pour que les autres sachent à ce qu'on parle. So I just want to say I'm sorry. I'm going to try to answer the questions in French. Also repeat the answer in English, and I'm sorry I didn't do that on the previous question. So I'll do that for this one as well. So I'll start in French. So alors pour les personnes qui viennent d'arriver sur le pont et puis voyagent au bateau, je sais que les officiaux sur le pont ont dit « OK, il faut aller tout directement au ferry et puis n'arrêtez pas pour chercher aller faire le shopping, et puis c'est possible d'aller directement là-bas. Et puis, je pense que hier, c'était le premier bateau qui vient d'arriver des îles de la Madeleine. Et on veut et on va travailler avec les paramedics ces paramédics qui étaient là-bas hier, et puis on va discuter avec eux l'importance, et pour les gens qui quand il vient à l'île, qui continue directement, et sinon il sait qu'il doit auto-isoler ici, même que les autres gens qui viennent. S'ils viennent d'Ontario, qu'ils viennent de Québec, s'ils sont à l'île du Prince-Édouard, ils doivent s'auto-isoler. Mais c'est un message assez difficile, et je sais que notre premier ministre King est en train de il a déjà fait un appel jusqu'à le premier ministre Québec pour en parler des îles de la Madeleine. So I'm going to just repeat the question in French was, what about the Magdalen Island ferry, and are we being clear that people, when they get off the boat, shouldn't, can they stay here in PEI, or are we telling them to directly leave the island? And so I think it's important that whether they're coming on the bridge or getting off the bridge and driving to the ferry terminal to get on the ferry to the Magdalen Islands, or if they're getting off the ferry in Magdalen Islands or in Surrey area and driving through Prince Edward Island, they understand that while they are in Prince Edward Island, they need to self-isolate. And that means it means the same thing in French as in English. And they are being also having the same message. I know my colleague in Quebec is giving the same message. And so it's the first boat came in yesterday to Surrey, and I think we need to work at trying to get that message improved, especially for that community. But I also think we need to someone may need to get off in an emergency and stop, and they may need to get gas, but what does that look like? So we have to figure out some of those details. But that's true for any islander who comes back, and if they're coming back from New Brunswick or Nova Scotia, they may need to get to their final destination at home. So how do we balance that importance of self-isolation that we continue to talk about, and keeping everyone safe? I don't have all the answers, and some of it's complicated, and I think we all need to try to do our best. But I agree, trying to get that message out will be really important.
Merci.
Merci.
Bonjour, Laurent Rigaud pour La Voix acadienne. I have a first question for Ms. Dowling about healthcare workers. In some countries, we are seeing a lack of face masks for staff. Can you tell us how much do we have here on PEI, and are you confident is it enough?
I don't have the exact numbers of how many we have, but we're continuing to monitor the supply of our masks in particular, both surgical masks and the N95 masks, every day. And we have moved to centralize our allocation of those masks so that we make sure we do have them available for the staff who need them. So our materials management department is monitoring that. We've also been looking at working with our vendors, and as you mentioned, across the country and around the world, there are some of the vendors that do have the groups who purchase from them on an allocation basis, and providing only a percentage sometimes of what we have ordered. So I don't have the exact number, but we do currently still have a supply, and we're continuing to monitor that, and also putting these other pieces in place, like moving to essential services reduces our use of some of these supplies. Centralizing or providing specific areas to be treating the respiratory illness patients will also help us centralize our supplies so that we make sure we do have them there for the workers and patients who are treating those types of clients. So that's really where we're working with, and we continue to also connect nationally through the Public Health Agency of Canada on accessing additional supplies from anything that they may have to allocate out to the provinces.
Thank you. Et j'ai une question pour vous, Dr Morrison. Pouvez-vous juste nous dire en français rapidement comment vont les 3 personnes malades, quel est leur état de santé, et juste rappeler en français quelles sont les conditions pour qu'ils arrêtent de s'auto-isoler. Est-ce qu'il faut qu'ils fassent plusieurs tests de suite pour valider le fait qu'ils ne sont plus malades?
OK. Des 3 cas, un cas maintenant, la première cas vient de finir son 14 jours de auto-isolement. Elle va bien, elle sent bien. Et puis, et c'est... on suit la guidance nationale, mais pour si les cas sont les personnes qui travaillent à l'hôpital, les healthcare workers, il doit avoir 2 tests négatifs à 24 heures entre-temps. Et on n'a pas les... c'est pas un cas à ce moment, juste pour être clair que qu'est-ce qu'on va faire. Et pour les 2 autres cas, ils vont bien chez eux. Et puis, chaque jour, il y a un contact d'une des infirmières de santé publique. Et je pense que ça, c'était ta question.
Oui, merci beaucoup.
Okay, merci. And just for those in English, it was we answered that question in English earlier about how the testing is done for the cases if they're a healthcare worker, and if they are not a healthcare worker in a case, then if they're doing well and they're not in hospital, then they will finish their self-isolation period and then be happy that it's over.
Dr. Morrison, Wayne Thibodeau here at CBC. Can I just clarify one point? I'm a bit confused about healthcare workers. So if a healthcare worker returns to PEI from travel anywhere else in Canada or the U.S., are they allowed to return to work if they're showing no symptoms?
So if, and it's a good question, Wayne. So we had already made it very clear that healthcare workers who are returning from international travel are not to go back to work. And we have a number of our healthcare providers who are self-isolating at home, who return from international travel, including the United States, after March the 8th. And that has been the policy with Health PI, and that has been made clear to the healthcare workers. In terms of the order that is, come forward in terms of returning travel from outside the province, healthcare workers are able to go back to work and return to work. And we have, for instance, some healthcare workers that commute from Nova Scotia to work, but they are closely monitoring for symptoms, and it's a bit of a risk assessment of me if they have been anywhere that has been where there's been an outbreak, considerable outbreak, for instance. I think those would be individual discussions. Obviously, if they've had any close contact with anyone who has had COVID-19, they would not go to work and in the system, and they will be closely monitored and for symptoms. And the healthcare workers, I've had a number of conversations with them in the last, individual healthcare workers who've called me, and they are really cautious at not wanting to spread illness and be the source of any infection. So they are certainly very conscious of that. Marion, I don't know if you want to add anything, but...
Yeah, no, I think we are following that guidance, and we believe that our staff are knowledgeable and trusted to be able to understand the symptoms and signs and be very diligent and vigilant in watching for those and making sure that they do not come to work when they are ill. This is their normal practice during an influenza season, but now they're being even particularly careful about coming to work, and also if they have traveled out of province and have come back since Saturday, then they are asked to be very, very careful and self-monitoring all the time to make sure there are no signs and symptoms.
But it is true, just to clarify, you can spread COVID-19 without showing symptoms, right? So they could be putting people at risk of this without showing any symptoms. Am I correct with that?
So Wayne, I think what you're talking about, this is why these recommendations and these discussions will change as time goes on. But right now, in the Maritimes and really in our maritime provinces, we are not seeing that sustained community transmission that they have in other parts. And so first of all, we would not be expecting many healthcare providers to. We want people to stay home. We are telling Islanders to stay home. And now we understand some have to come back and forth to travel, and some may be having to do some work somewhere else. So the number of healthcare workers who are going to be returning to the province from outside the country and outside the province are smaller as every day goes on, we hope. And it's and by far the majority of cases are certainly have symptoms, and in this country and around the world. So I think that is really important, and we have to remember what we know about the virus, how is it spread, and if we're doing hand washing, a lot of hand washing, and making sure we're not touching our face. That is how it's spread, and I think this is what we know at this time, based on the best science and our epidemiology for this area, and that can change. And it's also, again, why we would be testing healthcare workers right now with any symptoms, whether or not they've traveled. And I think that will also be important information to alleviate all of our concerns, and but also find anyone who might have COVID-19 here in PI.
Thank you very much.
Dr Morrison, François-Pierre Dufault de Radio-Canada, bonjour. J'ai une question pour vous en français, s'il vous plaît. Avec la fermeture de nombreux restaurants, de nombreux commerces, on voit de plus en plus l'apparition de services de livraison à domicile. Dans certains cas, les livraisons se font dans une distance de moins de 2 mètres de la personne qui a acheté des produits. Est-ce que c'est votre intention d'intervenir dans ce dossier-là pour clarifier un peu la façon dont ces livraisons se font pour limiter les interactions, les contacts entre les personnes?
Alors, je pense que merci pour la question. Et puis, si on trouve qu'on doit parler à quelqu'un qui fait les livraisons ils ne respectent pas la distance sociale, on doit les parler pour les informer et pour en premier s'informer qu'il peut en faire avec une méthode un peu différente. Alors, on va commencer par ça, et puis sinon, et puis on peut parler au propriétaire du business pour que c'est clair pour toutes les personnes qui font les livraisons dans cette occupation. The question is about concerns around people doing deliveries, that they aren't respecting social distancing when they go to deliver food. And first of all, thank you, because if that is an issue, then I think it's important that it comes to our attention, and we will be following up with a business to make sure that they're the people who are doing the deliveries can respect that social distancing and not put the public that they're delivering to at risk, or themselves. And I think both are equally important. So thank you. Okay, thank you very much.